my name's Abigail. I'm an ACP student. This is my 52-year-old male patient. This is part 3 of my GI assessment videos. I'm going to start by introducing myself to the patient and asking him a few questions. Hi sir, my name's Abigail. I'm an ACP student. Can you tell me about what's been going on today?
I've got this burning sensation in my belly today.
Okay, when did this pain start?
Probably about a week ago.
A week ago? Has it been this bad all week?
No, it started as not very bad pain. It's gotten progressively worse. It started on the left side, now it just seems like it's all over my upper belly area.
All over your
Kind of radiating to my back a little bit too.
Okay. When this pain first started, how bad was it on a scale from 1 to 10? 10 being the worst pain you've ever felt in your life.
Probably about a 3.
About a 3. And what would you say it is today?
Probably like a 9, I would say, yeah.
And do you have any pain anywhere other than your upper belly and your back? Any in your shoulders, your chest, your legs?
No, just my belly and my back.
Okay. Any nausea or vomiting over the last couple of days?
I've vomited a couple of times in the last probably like 12 hours.
12 hours. Any blood in your vomit that you could tell?
Not that I noticed.
No. How have your bowel movements been the last few days?
I was kind of constipated. I think my last one was about 3 days ago.
Okay, and what did that look like?
Just a bunch of like hard pellets, I think, yeah.
Any blood in your stool that you could see?
Not that I noticed.
Okay. Has your urination been normal the last few days?
I think so.
Any pain, burning, blood?
No, not that I noticed.
Okay. Have you ever experienced a pain like this before?
No, first time.
First time. Has anything been making the pain any better, any worse?
Not really. It's just really uncomfortable.
Okay. Have you taken any medication for the pain?
I took some Tylenol, some extra strength Tylenol a couple hours ago.
Did that help at all?
No.
No. Any pain when you take a deep breath in?
Yes, it makes it worse.
Okay. And what about your eating habits the last few days? Have you been able to keep food down? Have you been eating much?
No, most of the time when I eat, I start to feel more nauseous and the pain gets worse, so I haven't been eating very much. I've lost about 6 pounds, I think, in the last week.
Okay. Next, I'd like to do some physical exams on you. So to start, I'm going to do a blood pressure on each of your arm to assess for any discrepancies, which could be indicative of an aortic aneurysm. Does that sound okay?
Sure.
Fantastic.
You do what you have to.
Blood pressure. Assessing for a greater than 20-point difference between his 2 arms. Next, I'd like to do an ECG on you. This includes me putting 10 stickers on you, some on your shoulders, your abdomen, and then on your chest along your left pec. Does that sound okay?
That sounds okay.
Fantastic. Sticker. I'll just get you to sit nice and still for about 30 seconds while we take this picture. The patient's ECG has no abnormal findings. Next, I'd like to do a physical exam of your abdomen. To do this, I'm going to have you lay down on the couch. I'll start by inspecting your abdomen, and then I will listen to your bowel sounds. I'll percuss, which will include me putting my hand on you and tapping gently to listen for any abnormal sounds. And finally, I will palpate, feel around your abdomen to see if there are any masses or if it makes your pain any better, any worse. Does that sound okay?
If you have to.
Any questions before we get started?
No.
Fantastic. We'll get you to lie down and expose your abdomen.
Okay.
First, I'm going to physically assess his abdomen. To start, I'm looking for any pulsating masses or any distension. I'm also looking for any Did I just say that? I'm also looking for any bruising. This patient is positive for a Collins sign with the bruising around his umbilicus.
I hadn't noticed.
Okay. Must be new to you then. Have you been hit in the stomach recently at all?
No.
Okay. Next, I'm going to listen to your belly with my stethoscope. This might be a little bit cold, but it shouldn't cause you much discomfort. Is that okay?
That's okay.
Fantastic. I'm going to start in the right lower quadrant, moving to the right upper, left upper, and then down to the left lower, listening for bowel activity. Patient has activity in all 4 quadrants of his abdomen. Alright, next I'm going to be percussing your abdomen, so I'll just get you to lie nice and still. You don't need to do anything, you're just going to feel me gently tapping on your belly, okay? Any questions?
No.
Next, I will be palpating the abdomen, feeling around to see if I can feel any masses. I want you to let me know if it makes your pain any better or any worse. As I'm doing this, it may cause some discomfort in your upper abdomen. Please let me know, and I'll try to make it as quick as possible, okay?
Okay.
Any questions?
No.
Starting in the lower abdomen, any pain?
No.
Not feeling any distension as I'm doing this. I'm looking at my patient's face for grimace as well. Upper quadrant.
Ow.
I'm sorry.
Ow.
Same on both sides.
Yeah.
Finally, I'm going to be assessing your belly for rebound tenderness. So I'm just going to push my hand into your abdomen like I just did and then release it quickly. I want you to let me know if you have any pain when I push down or when I take my hand away. Any questions?
No.
Any pain?
No.
Fantastic. Next, I'm going to be performing a Lloyd's test on you. So I'll get you to sit up on the edge of the couch. This will involve me putting my hand on your back and tapping quickly. If you have a kidney stone or any issues with your kidney, this may cause some pain, so I want you to let me know if there's any discomfort as I do this.
Okay.
Any questions?
No.
Just putting my hand on the 12th intercostal, and I'm going to give a quick tap. Any pain?
No.
And the other side here. Any pain?
No.
So no indication of kidney stones or renal colic for this patient. And that concludes my abdominal physical exam. Thank you so much for watching.